As we all can see now, our group presentation will consist of five parts, which is the first one, the definition, the second one, the role of integrity in individual and effective corporate leadership, the third one, factor affecting professional integrity in nurses, the fourth one, example of an integrity in nursing profession, and last but not least, conclusion. What is integrity? Integrity is defined as a wholeness or completeness, particularly in terms of individual characteristics. It also means having a strong adherence to moral and ethical principles and values such as honesty and trustworthiness. A person with integrity behaves ethically and does the right thing even when no one is watching.
The first article that we choose is the role of integrity in individuals and effective corporate leadership. Here, Douglas states that integrity is more than ethics and it is about the character of individuals which consists of considerate, compassionate, transparent, honest, and ethical. Next, I will be explaining on this one model called Turnet Leadership Character Model by a psychologist named Dr. Robert Turnet. He stated that integrity is the foundation of the model in which, for the leader to be successful and evolve a careful balance between respect and responsibility. This model also not twist fact for personal advantages, willing to stand up for and defend what is right, will be careful to keep promises and keep counted on to tell the truth. Hence, to be a great leader, we need to have high level of integrity. Moving on, the impacts professional integrity in nurses is good for developing leadership. Secondly, build trust in relation with others. And thirdly, employees are motivated and creative, take pride in their work. The second article is Factors Affecting Professional Integrity in Nurses. In this article, 17 urinary nurses were interviewed for research purposes, and it consists of 3 head nurses, 2 faculty members, and the rest were clinical nurses. Professional integrity has connection between actions, beliefs, and principles. Even though this study is carried out in Iran, but it is reliable because professionals' integrity has no boundary. However, this article cannot answer what is the factor can reduce or increase rate of professional integrity. After analysis, the latter meanings were formulated into one main theme, which is keeping up confident beliefs, which consists of religious belief, inner call, philanthropic senses, empathetic care, and divine rewards categories. This is the table to summarize the analysis of the article. There are categories and subcategories. The first category is religious beliefs, and the subcategories is God's observation on acts, considering God in care affairs, acquiring halal income, trust in God, and acquiring God satisfaction. So basically, God influence our act. The second category is inner call, inner persuasion to do the best for patient, job conscience, and inner call for having integrity in care. The third one is philanthropic sense, being interested in serving people, cherishing the existence of humans, feeling the need to help people, and loving the profession. The fourth one is empathetic care. Consider myself as a patient, consider relative as a patient, and empathy with patient. So basically, we are putting ourselves in the patient's shoes. Lastly is divine rewards. God returns the result of honest care, having God blessing, low worthiness of profession, financial aspect, and tranquility in life.
Example of integrity in nursing profession. Situation: Berlin, an anti-vaccine nurse in Germany has been accused of not giving 8,600 individual COVID-19 vaccine injection instead only giving saline solutions. Utusan Malaysia 2021. From this situation, we can see that integrity in our decision and action encourage us to be honest to all people in our daily life. As a nurse, integrity is one of the main key to keep our professionalism when taking care of our patient. Plus, integrity is important to ensure our patients receive the treatment and care they needed securely. From the situation given, we can see that the integrity is not shown by the nurse when she gave saline solution instead of giving COVID-19 vaccinations to the people. This might lead to mistrust among the people toward the healthcare system in that state. This can be supported by literatures published by Walter Cleworth Health on 2015, where he mentioned that patient safety depends on professional integrity. Plus, integrity will serve as the best way to protect nurse professional reputation and moral character as well as the patient in his or her care.
Now we have come to the conclusion. Integrity is the quality of a person being sincere, faithful, and truthful in appearance, speech, and action. Professional integrity increases work productivity and helps in maintaining a positive environment. People with professional integrity have a significant benefit at the workplace because they don't have to put any extra effort to be honest and become a person on whom everyone depends. This is our references. Hopefully our presentation enlightened you about integrity. Thank you for lending your ears and that's all from us. Thank you.